All right, Ray, so we'll get started now.
I'm very self-conscious.
Part of my practice involves doing pro bono work for patients who've been trauma victims.
I told him about what had happened to me a number of years ago.
And her story was so striking that I wanted to do more for her.
When I was younger, in my early 20s, I got involved in a relationship that I was very unprepared for because in my background I'd never had any experience with abusive relationships or anything. I found myself with a very violent man who savagely beat me. My lip was in 2 pieces and my chin was exposed. My whole face was fractured.
We enrolled her in our pro bono program where I do services for women who've been victims of trauma or abuse.
When this beating happened, I was actually kept in the apartment where we lived and was not allowed to go to the hospital. He kept me there for almost 2 weeks. If I had come into emergency right away, they could have put plates and repositioned the bones in my face, and I probably would have not had the ongoing problems that I did with my eye and my nose and my face being broken.
When somebody looks at you, the first thing they're going to look at is your face. That's how people make judgments. It's how they make decisions. It's how we see ourselves. You know, one of the amazing things that we can do with plastic surgery is we can change and augment the face in a way that's really complementary to how good people feel and really help them look as good as they feel.
It has been awful. I try not to look at pictures of myself. That is one of the hard things because it just jumps right out at me when I see a picture of myself. I see the scars.
We'll first start with the nasolabial fold or the line over here. Our process is going to involve giving her back something that she lost because she was a victim. Here and here. And then filling this in is not a problem. What we're going to do today is we're going to consult with our patient, Ray. We're going to talk about the issues that she identifies. She had quite a bit of trauma to her face and went through many reconstructive surgeries. And because of this, she has an asymmetry in her face.
It's always been a handicap. I've never had the confidence that I think that I may have had if this hadn't have happened to me. Yet, being a survivor of this kind of violence has definitely given me some confidence in other areas because I have survived it and I did get away and I have made a new life for myself.
We're going to be using some new technology. So now what I'm doing, Ray, is I'm actually lifting up your face and I'm adding volume to your cheekbone that was not there because of the trauma. And it's actually going to lift the entire right side of your face up. But we're going to use this cannula to deliver the product in a way that's going to minimize swelling and bruising. The real advantage with using the technique that we're going to use today is when you use needles and you cause bruising and swelling, it alters how your result's going to look like while you're doing it. With cannulas, we get a lot less bruising and swelling, so we can really fine-tune the procedure. Our goal today is going to be to help lift the face, fill the face, and then we're going to work on both sides to make sure things look the same right and left.
Time is not my friend when it comes to this. I realized I am focused on it probably more than other people because it is my story and it is what I see. But it just seems to be worse because as I'm aging, the volume in my face is changing, making these uneven planes even more obvious to me.
We lifted this, and we did the cheeks. It makes them feel better, it makes them live better. It makes them enjoy their life more.
It was really good. And he explained to me what he was doing. My face looks like both sides match. And that is amazing to me.